Good morning, ma'am. Good morning, classmates. So we are the group 8 and I am the first reporter and I will be discuss about congenital malformation. Common congenital malformation in newborns. Objectives. Explain the origin and characteristics of common congenital malformation. Discuss the difference between malformations, deformations, and disruptions and some example of each. Example of teratogens and their effects on fetal development. So, congenital anomalies are structural defects present at birth, may or may not manifest clinically at birth, represent the most significant cause of death in infants. Rates of congenital anomalies in a risky pregnancy are higher. Most of these are not compatible with life. In simple term, congenital refers to the existence at or before birth. Causes and risk factors, genetic factors, socioeconomic and demographic factors, environmental factors, infections. So first is genetic factors. So although approximately 50% of all congenital anomalies cannot be linked to a specific cause, there are some known genetic, environmental, and other causes of risk factors. Um, it is also a genetic factors can play an important role in many congenital anomalies. This might be through inherited genes that code for an anomaly or resulting from sudden changes in genes known as mutations. So, um, consanguinity when parents are related by blood also increase the prevalence of rare genetic congenital anomalies and nearly doubles the risk of neonatal and childhood death, intellectual disability, and other anomalies. Some ethnic communities um, have a comparatively high prevalence of rare genetic mutations such as cystic fibrosis and hemophilia C. So the next is socioeconomic and demographic factors. It is it is low income may be an indirect determinant of congenital anomalies, with a higher frequency among the resource constrained, constrained family and countries. It is estimated that about 94% of severe congenital anomalies occur in low and middle income countries. An indirect determinant this higher risk relates to a possible lack of access to sufficient nutritious foods by pregnant women, an increased exposure to agent or factors such as infection and alcohol, or poorer access to healthcare and screening. Factors often associated with lower income may induce or increase the incidence of abnormal prenatal development. Maternal age is also a risk factor for abnormal fetal development. Advanced maternal age increase the risk of chromosomal abnormalities, including Down syndrome. The next is environmental factors. Maternal exposure to certain pesticides and other chemicals, as well as certain medications, alcohol, tobacco, and radiation during pregnancy may increase the risk of having a fetus or neonate affected by congenital anomalies. Working or living near or in waste sites, smelters, or mines may also be a risk factor, particularly if the mother is exposed to other environmental risk factors or nutritional deficiencies. The last is infections. Maternal infections such as syphilis and rubella are a significant cause of congenital anomalies in low and middle income countries. So, what is malformation? Malformation is intrinsic errors in morphogenesis that lead to improper formation of one of the multiple organ system. Generally, multifactorial can range in severity from incident to lethal. And also it is malformation, irregular, anomalous, abnormal, or faulty formation or structure, a structural defect in the body due to abnormal embryonic or fetal development. Examples: micro micrognathia, so, and also neutral tooth defects. Example: um, mic- micrognathia is a conditional in which the lower jaw is undersized. It is a symptom of a variety of craniofacial condition, sometimes called mandibular hypoplasia. And also micrognathia may interfere with your child's feeding and breathing. Most cases of micrognathia are congenital, which means that children are born with it. Some cases of micrognathia are due to inherited disorders, but in the other cases, it's the result of genetic mutations that occur in their own and don't pass down through families. It causes in children who are born with certain genetic condition, such as trisomy 13 and progeria. It can also be the result of fetal alcohol syndrome. In some cases, this problem goes away as the child jaw grows with age. In severe cases, micrognathia can cause feeding or breathing problems. So micrognathia is fairly common in infant and can often correct itself as your child grows. In some children, micrognathia can cause abnormal tooth alignment because there is not enough room in your child's mouth for the teeth to grow. Micrognathia can present as a birth defect in numerous syndromes, including cleft lip, cleft palate. Cleft lip is the birth defect that result in a unilateral or bilateral opening in the upper lip between the mouth and nose, while cleft palate is birth defect characterized by an opening in a roof of the mouth caused by the lack of tissue development. So the second example is neutral tube. It is defect or birth defect of the brain, spine, or spinal cord. They open the first month of pregnancy. Often before a woman even know that she is pregnant. The two most common neutral tube defects are spinal bifida and anencephaly. Um, the final spinal column closely completely. Anencephaly, it is a serious birth defect in which a baby is born without part of the brain and the skull. It is a type of neutral tube defect or NTD. As the neutral tube form encloses, it helps from baby brain skull, upper part of the neutral tube, spinal cord and backbone, lower part of the neutral tube. So what is the cause? Um, the cause is when the neutral tube fails the close at the base of the skull. Neutral tube defects may be caused by genes passed on from both parents and by environmental factors. Some of these factors include obesity, uncontrolled diabetes in the mother, and some prescription medicines. So, congenital anomalies are malformation, disruption, deformation. By this topic will be discussed to the next reporter.